You're sitting on the side of a field or perhaps on the side of a running trail and your knee is killing you and you're wondering, do I have a serious knee injury? Is this a severe problem? Should I call a doctor? Should I go to the emergency room? Can I wait this out? Hey folks, I'm Dr. Howard Lux. I'm an orthopedic surgeon in Westchester County, New York. I've been online providing you with actionable, relevant and evidence-based information online for nearly 10 years. We've been reviewing a number of questions in this video format, and this is just one of our latest. So you've hurt your knee, whether this was a twisting injury or you were running and you tripped on something. You're wondering, is this a severe injury? Is this a serious injury? How exactly do I know? We're going to go through 6 things that you should look for to help determine if your knee injury is serious. The first, you heard a loud pop. So this is usually pertinent to young athletes. So we have young soccer players or lacrosse players, and they're turning or twisting and pivoting around on the ball field, and they turn and they feel a pop. Now they're on the ground and perhaps the knee is already starting to swell. They're having some difficulty walking off the field. One of 2 things has likely happened. In many instances, these unfortunate athletes have torn their ACL. In another situation, they have perhaps dislocated their kneecap or patella. Both of these are serious injuries. These knees will swell, they'll be difficult to walk on, and you might not need to go to emergency room, but you should be seeing a sports medicine physician or an orthopedic surgeon relatively soon. Now, there are others closer to my age where we were running or we knelt down and we pivoted and we also felt a pop. Now, more often than not, that is the result of a meniscus tear. Now, these meniscus tears are oftentimes more degenerative as we get to into our 4th and 5th decade, and these are not necessarily considered serious knee injuries. It's okay to wait a few weeks to see if your symptoms subside and the knee starts to feel a little better before you rush off to a doctor's office. Now, swelling. Swelling is very common after knee injuries or in anyone with knee pain. But what I'm talking about here is significant size swelling. Your knee looks like a football, or your knee is now the size of a cantaloupe, and that followed either a contact injury, it's a football player who was struck, or again, our soccer or lacrosse players who turned and twisted, they felt a pop, they're having difficulty walking, and there's no question about whether or not their knee is swollen. That fluid inside the knee is more often than not blood. It can be quite painful, and that's why these knees are hard to bend. I'm not talking about swelling that occurs after a long walk or you're out gardening and you're 65 years old and perhaps have a history of arthritis. That is not considered to be an injury, likely not to be severe. So what else do we look for? We look for someone who can't straighten their knee. This is a unique type of injury, often caused by a meniscus tear we call a bucket handle tear. With a bucket handle meniscus tear, you've turned, you've twisted, you've torn the entire meniscus. The entire meniscus has now flipped into the middle of the knee joint, blocking your ability to straighten it. Now, many people come in and complain that they can't straighten the knee, and we find out that it's because of swelling or blood in the joint. When you have a bucket handle tear, you feel as if there's an actual mechanical block. There's something there actually preventing you from fully straightening the knee. A bucket handle tear is not an emergent issue. It is certainly not worth a trip to the emergency room, but you should see a sports medicine physician sooner rather than later, since many of these are repairable and the results of a repair tend to be better sooner rather than later. Locking. Locking is very similar to not being able to straighten the knee. You've sustained an injury, whether it was a twist or you were struck, and now the knee feels locked. That can indicate a problem with your kneecap. It could mean that you knocked off a piece of cartilage from one of the ends of the bones, or as we discussed in someone who can't straighten the knee, it can also mean that you have a bucket handle tear. So if you've injured your knee and it feels as if it is physically blocked or locking you and prohibiting you from moving it easily, you should consider this to be a serious knee injury and you should see an orthopedic surgeon. Weakness. Weakness is something that tends to follow injuries in weekend warriors and older athletes over 30s and above. So if you are heading up the stairs, you're running up a basketball court, you're on a tennis court and you feel a pop in the front of your knee, then you go and try and walk on your knee and it gives out and the leg is really weak and it just doesn't feel secure and you're not sure you can walk on it because it's going to give out again. You may have torn either your patella or your quadricep tendon. Those are two very big, strong tendons on the front of your knee. And if they are torn, this is a surgical issue because you will not be able to stand on that leg with any strength or have any stability unless the quadricep or patella tendons are fixed. These usually end up with a visit to an emergency room. And if your surgeon is available, they can often fix it that same day or the next day. If you have a pair of crutches, you can certainly make an appointment to see your orthopedic surgeon over the next day or two. So, is your knee injury serious? Is it severe? What do we look for? We look for very quick or almost immediate significant swelling. It will not be a question, is my knee swollen? Your knee will be huge, it'll be the size of a grapefruit. That is a potentially serious injury. You turned and pivoted and twisted, and you felt a pop. Again, patella dislocation, ACL tear. Not an emergency room visit, but certainly should be seen by an orthopedist. Weakness and locking. Again, also signs of a serious knee injury. So I hope this helps you better understand whether or not your knee injury is serious and whether or not you need to see us on a more urgent basis. This might help you with determining what's going on with your knee when you communicate with our offices. Again, my name is Howard Lux. I want you to click that little subscribe button down there so you continue to receive these videos. Look for me online at my website or on Instagram and Facebook. Take care. Good night.